How can colectomy transform life after diverticulitis? Imagine a life where the fear of sudden pain or emergency hospital visits no longer dominates your days. For many people with recurring or complicated diverticulitis, this can become a reality through a surgical procedure called colectomy. Colectomy involves removing part or all of the colon, which is the large intestine, to eliminate the source of inflammation or infection. Diverticulitis causes small pouches in the colon wall to become inflamed or infected, leading to symptoms like abdominal pain, fever, and sometimes serious complications such as abscesses or perforations. When these episodes happen repeatedly or become severe, doctors often recommend surgery to improve quality of life and prevent future health issues. Most commonly, a sigmoid colectomy is performed, where the affected part of the colon, usually the sigmoid colon, is removed. This can be done through traditional open surgery or, more often today, using minimally invasive methods like laparoscopy or robotic surgery. These techniques involve smaller incisions, which typically lead to less pain, quicker recovery, and fewer complications. After surgery, many patients notice a significant decrease in symptoms. They often experience fewer episodes of pain and discomfort, and the risk of developing serious complications like abscesses or perforations drops sharply. One of the biggest benefits is that patients can return to their daily routines without the constant worry of a diverticulitis flare-up. Many report feeling more energetic and less anxious about sudden pain or emergency hospital visits. Studies show that especially when the surgery is done laparoscopically, patients tend to have higher satisfaction and better overall outcomes. For women, in particular, the improvement in quality of life after colectomy can be quite noticeable. Of course, like any major surgery, colectomy carries some risks. These include infection, bleeding, or issues with reconnecting the remaining parts of the colon. Sometimes, a temporary or permanent ostomy is necessary, which is an opening in the abdomen for waste to exit the body. This is usually a temporary solution until the colon heals enough to reconnect, or it may be permanent if reconnecting isn't possible. Recovery typically takes a few weeks, during which patients might feel tired or weak, but most regain their strength and energy over time. It's important to remember that colectomy isn't the right choice for everyone. The decision depends on individual factors such as how often and how severe the episodes are, whether complications have occurred, and personal preferences. Healthcare providers now focus on a patient-centered approach, discussing all risks and benefits thoroughly and involving patients in the decision-making process. In the end, for many people, colectomy can be a life-changing step that reduces pain, prevents future health emergencies, and restores confidence in daily life. But it's essential to consult with healthcare professionals to determine if this surgery is appropriate for your specific situation. Every person's experience with diverticulitis is unique, and treatment plans should always be tailored to individual needs and medical advice.